Tired of being reactive when it comes to your healthcare conditions? Let's talk about it. My name is Dr. Erica Steele. I'm a holistic doctor in family practice, board certified naturopathic doctor. I hold 6 degrees in my field. They're all in the natural healthcare space. I've been in practice for over 20 years. I've treated thousands of patients. I do lots of education to teach you and your family how to be more proactive with your health. I have tons of courses. You can click the link below and check out all kinds of different courses, from detoxification to nutrition to mindset to emotions to time management, you name it. Over the years of really working with patients, I've discovered what the pain points are with human beings and what they need in order to help them heal holistically. All right, let's jump into it. So, what is it when we're in reactive cycle, right? We wait, and we neglect, and then all of a sudden we have these debilitating symptoms. The other piece is that we're ignoring. So we're checked out, we're disassociated, we're constantly going. We've got work obligations, family obligations. We're not taking care of our bodies, we're not taking care of our minds, we're not taking care of our spirits. And so we're ignoring, we're checking out, we're not being fully present. And then bam, I can't tell you how often people would come into my practice and they'd be like, this happened out of nowhere. No health condition, unless it's, an acute care situation like a car accident or some tragic accident. It doesn't happen out of anywhere. Chronic disease, even autoimmune driven diseases, they happen over time because it's a breakdown in the metabolism. It's a breakdown in the biochemistry. So instead of waiting until something becomes a problem, we want to be more proactive with our health instead of constantly just be managing our disease process. So what it looks like to manage it is you only see a medical doctor once a year. Nothing against medical doctors, but they're not trained to really look in depth at your biochemical markers, meaning they're not trained to look at your nutrition and how you're digesting and assimilating and how your liver is functioning, other than, let's say, a cirrhosis or cell damage or something like that. They're not trained to look deeper. They're not trained to look at detoxification. They don't see that as a valid option, and nothing against their training. They're really great for acute care situations, like if you're in an accident or if you need surgery, or if you have an advanced stage cancer, that absolute aggressive cancer that needs, some other pharmacological interventions. It can be very helpful and life-saving. I know it's saved mine. However, we as patients must be personally responsible with our health, which means we're not just going to be totally checked out and devoid, and then we roll into the doctor's office looking for them to save us and fix us, because that's not their role. And so if you go have your annual checkups, that's great. But remember, when they say that your labs are normal, all they're saying is there's no disease process to diagnose and manage, because that is their frame of reference. That is what they're trained to look for. They're trained to look for disease. So when you come in and they're like, oh, everything's fine, yes, it may be fine from their lens. But when we peel back the layers and we look more deeply at the lab panel, because my expert training is in clinical biochemistry, when I start to look at that, especially from a functional medicine lens, I begin to see, oh, this is the nutrient deficiencies. The patient's not breaking down proteins. The patient's not adequately processing their fats. They're eating too many fats. Their liver is sluggish. These are all these things that happen way before it becomes a disease process. And so we want to catch those things and have a more proactive mindset instead of reactive. Because when we're proactive, we're doing the steps that it takes in order to heal. We're drinking the water. We're eating the protein. We're measuring our protein. We're moving our bodies. We're meditating. We're managing our emotions. We're doing all the things that help keep us well, right? And so sometimes it's like, oh, well, Dr. Steele, that's fine. But I already know people who do all that stuff and they still get, etc., right? We can't prevent every single health care issue. Unfortunately, I wish we could. Then suffering would end. But we can do our part to be able to ensure that we have a long, naturally living life, right? And so if you want to learn more about how you can take personal responsibility with your health and really learn deeply about your body, I'd be happy to help you. We have tons of courses below. You can sift through them. It really dips your toe in. There's ones with videos in there, the questionnaires, checklists, task lists. It's all in an app format. So you can track your food, you can track your water, you can track your body biometrics. You can really really take a proactive approach with your health rather than a reactive approach. Naturally, if you need a deeper look or deeper consultation to look at your review, I'm happy to do that. You can check out one of my virtual clinics that offer, or you can check us out on any of the social platforms. We do a lot of live Q&As, especially on TikTok and things like that, and Clubhouse as well. Thank you so much for joining, and like, share, and subscribe, and comment below.